Welcome everyone. Today I want to talk to you about the biggest question that we get here. Certainly within our top 5 questions of all times, what is the best weight loss operation? Which operation is better? So I'm going to take on that question today, hopefully give you some good information, help you make your decisions, and I want to try to look at this from a evidence-based sort of data-proven standpoint. Some of it will represent opinion, but certainly let's get to the big issue of what is the best in weight loss surgery. So before I get started, I have to give a shout out to my friends out at Forge Clothing. I've got their shirt on today. This is the company who is owned and operated by a Navy SEAL, a company that's very supportive of those who serve and have served. So a big shout out to everyone serving, both past and present, and especially those who made the ultimate sacrifice. I greatly thank you for the freedom we enjoy here. And one more shout out. This is, you can see behind me here, I've got my sloth sanctuary, or at least part of them. I think a few of them have wandered off, but I have a new addition to the sloth sanctuary, and this is Simon. So Simon, this is a 3-toed sloth. And the 3-toed sloth is actually much harder to raise in captivity. But Simon is doing very well in our sanctuary here. And I want to thank Susan Morrison, who I worked with many years at Citizens, for Simon. And she's also a fellow Oklahoma State graduate. So I just want to let her know that Simon's doing very well in our sanctuary here. And I'll put it back in place. So let's get on to our question. What is the best weight loss operation? Well, you know, I'd like to say, just to start this off, that to discuss what is the best weight loss operation, think of this like you would, what is the best means to fly, a helicopter or an airplane? Well, it often depends on the application. If you've got to land on an oil well derrick out in the middle of the Gulf, then the helicopter is your only option. So let's think of it like that. There's going to be circumstances where one procedure may be most suited for an individual, and the other procedure the same. Because we're going to really talk about 2 operations, and let me just grab this little visual guide here, and I want to talk to you about the sleeve gastrectomy and the gastric bypass. So this is the Roux-en-Y gastric bypass, or more commonly called the gastric bypass. Oftentimes you'll hear people say lap gastric bypass, or lap sleeve, or sleeve gastrectomy, or the bypass, and these are all referring to one of these 2 operations. And these are the 2 common procedures that we talk about today. There are some other procedures, but let's focus on the 2 most common, and let's kind of talk about why we would favor one of these over the other. To start that discussion, I'd like to say that both of these procedures in most centers today are performed in the standard laparoscopic approach, using the minimal invasive technique, to where you make the small little incisions going through the ports. You're watching everything on a video, using videoscopic surgery to perform these procedures. So there's not a big difference in the technical approach to these operations. There is significant difference in what's done. When we talk about the sleeve gastrectomy, we talk about a 1-stage operation because it works exclusively on the stomach. You can see that the stomach is trimmed down to roughly be the size and shape of a banana. And when you compare that to the gastric bypass procedure, you're going to see that it's a 2-stage operation. The stomach is essentially jumped over by making a small stomach pouch at the top, jumping over the stomach down to the intestines, and there's a 2nd stage to this operation at the intestine level. The effect of the gastric bypass is it will have some additional component to limit calorie absorption, and there is some benefit to that we'll talk about in a minute. So the main difference is the 1-stage versus the 2-stage operation. And as I kind of talk about these, I'll talk about some of my experience I've had with patients over the years. And one of the most common things that I get when I hear people talk about the gastric bypasses, they say, well, you know, I'm a little concerned about that operation because it seems to be so much more invasive, that it is changing things. And I understand that. I appreciate those comments and where that's coming from. And usually we'll want to lead that, continue that discussion with comments about why that second part of the operation is very important in some patients, because that's an actual benefit that we're looking for in particular patients with that second stage. So let's go back to our sleeve gastrectomy and just talk for a second about this operation. So what is attractive about the sleeve, just working on the stomach level, is it uses the stomach to just restrict it down to a more fixed shape and size. And it also has the benefit of actually restricting the amount of hunger hormone production. You may have heard that hunger hormones are generated in the lining of the stomach. And removing a considerable portion of the stomach is actually going to do a great job of limiting the hunger. So when we talk about the sleeve, we're talking about hunger control, and we're talking about restriction of food contents. So it sounds like a great option, sounds like a great tool, and in many cases, one may argue that, well, that would satisfy everyone. So why talk about gastric bypass? Well, when we get to gastric bypass, we see that jumping down to the intestine level can do some things that we may not see in that intense immediate effect like we do with the sleeve gastrectomy, particularly related to diabetes. When we talk about gastric bypass, we're typically talking about diabetics now where they're unable to control their blood sugars. And there is a benefit that's proven in gastric bypass patients by moving this part of the intestine to change some of that food absorption that gives an immediate benefit to the diabetics. And the actual remission rate, the ability to come off medications and show diabetic remission, is extremely high with the gastric bypass. Remission of diabetes can occur with the sleeve gastrectomy, but that remission seems to be more related to the weight loss. This is related to weight loss and the intestinal rearrangement that's changing the absorption of food. So we're going to see an intense benefit for the diabetic patients with the gastric bypass. The other reason that we talk about gastric bypass is desired weight loss. We know the gastric bypass typically kind of gets the nudge when it compares to sleeve gastrectomy for degree of weight loss, when you compare many patients like in a study group. And I like to use data that's been proven in study groups and kind of look at evidence-based. And like I said, some of this is based on my experience. We've been performing these procedures here, particularly gastric bypass, at Citizens for now 20 years, 2 decades. I actually introduced this laparoscopic gastric bypass to South Texas back in 2000, 20 years ago. So based on our experience, we see a great benefit to the diabetics and people that want to lose more weight than may be typical with the sleeve gastrectomy. Weight loss in the gastric bypass group can easily move up in excess of 100 pounds, 150, 200 pounds. So when we have a desired weight loss in that range, we may be more interested in gastric bypass. Now, when we compare that to sleeve, we see very good weight loss with the sleeve gastrectomy as well. It's just that there is a slight difference in the degree of weight loss based on that second part of the operation, the bypass that involves the food absorption. Now, changes nutritionally. When we talk about the sleeve gastrectomy versus the gastric bypass, we're going to talk about some absorption changes of certain vitamins. We see that with the gastric bypass group, there's going to be some limitation of vitamin absorption that may not be experienced with the sleeve. B12 vitamin is a vitamin that's often talked about that can be affected. The absorption can be affected when you have stomach surgery. That's going to be with both groups, bypass and sleeve gastrectomy, because the B12 vitamin has to bind in the stomach to a substance called intrinsic factor. And without that binding, you're going to limit your absorption of B12. So you'll often hear people talk about that they have to take B12 after weight loss surgery, and that's very common because it's not absorbed orally. And we're looking at doing that like placing a B12 under your tongue, sublingual, or an injection or intranasal or some route other than the stomach. Vitamins that would also be replaced with gastric bypass patients would include vitamins like calcium, iron, vitamin D, because there will be some limitation of absorption that occurs with this food absorption. But again, this is going to be weighed against the benefit of improving diabetes, enhancing weight loss. So both operations have very good points. Both operations have some maintenance requirements. Now, the big question I get is safety of one versus the other. And there are some specific data results on this. But what I want to say is that the safety of these operations is really based on the experience of the team, the institution, the surgeon. And if you find that you have a surgical team that has many years, many procedures of experience, that both these operations are going to be very safe procedures and laparoscopically performed, minimal discomfort, short hospital stays, and very safe procedures. So ultimately, the thing to do is someone considering weight loss surgery is certainly do your research, look at the information, try to compare data based on many people's experience, like in data-proven centers and things like that. The experience of 1 to 2 people can vary from one procedure to the other. And then come talk to your surgeon, come talk to your surgical team and lay out the specifics of your health, your concerns, and see which operation best suits you. It's certainly been my experience and the experience of many others that we love to work with the patient, coming to a mutual understanding of what is the best operation. And certainly give information that seems to be in the best interest of the patient's conditions, but ultimately it's the patient's choice and working to come to a good understanding of what is the best choice. And I hope that that gives you some insight to the difference between these procedures. And don't forget, if you want your questions answered, send them to our website. That's Citizens Bariatric Center. You go to the contact information and you can submit your question. Or you can go to the Citizens Bariatric Facebook and send the question through Messenger. Be happy to take a look at your questions, and hopefully you'll see those on a future video.